Hi, I'm Dr. Colleen Guilfoyle. I'm a veterinarian here at Best Friends, and I'm going to give you guys a tour of our main clinic. This is our reception area, so the animals come in through the front door, and our receptionist greets them and finds out what their main problems are and what we can help them with. This is one of our exam rooms. So the animals will come in here and we'll get their weight. We'll get some vitals, which are like a heart rate and a respiratory rate, how fast they're breathing, with our stethoscope. And we'll see what we can help them with. On these computers, we take medical notes. Medical notes are really important in veterinary medicine and all types of medicine. So we take really detailed notes of what we do and what our diagnosis is and what our plan is. If we come back here, we'll head towards our surgery suite. Animals that come for surgery, usually here it's mostly spays and neuters to make sure that they can't have any more puppies or kittens to help with pet overpopulation. They'll check in here. We can find a place for them to stay during the day. We get them weighed and we get them ready for surgery. In these stations, we intubate the patient, so that's where we put a tube down them so that they can breathe while they're under anesthesia. And we give them different medications to help them fall asleep for surgery. And they'll also be recovered here, so people will make sure they wake up from anesthesia okay and that they return to their families safely. This is one of our surgery suites. So you'll see anesthesia machines, operating tables, big surgical lights. And then when surgery is actually going on, there's a lot more stuff involved. So there's tables covered in instruments and all the different types of equipment we use to do different types of surgeries. It's really important that we clean. So we use really powerful cleaners to clean up after each animal. And we always make sure we wash our hands and we wear personal protective equipment. So that is gloves and masks and gowns to make sure that we don't give germs from one patient to the other patient. At this station, we draw up medications for general anesthesia. So we use different types of syringes to draw up different medications that we inject into the animals. This is our treatment area. So sometimes when animals get brought into the back or we need more help, or in hospital patients, they'll all be back here as well. Back here we can do a lot of simpler procedures that we wouldn't do in surgery. So we do things like nail trims and less complicated procedures will go on back here. And then all of our in-hospital patients are housed in here. This is our lab. So in here we do all sorts of different kinds of testing, like blood work, and we look at different samples that we might take from a pet. If you look here are some slides where we poked different lumps and bumps, and then we look at them under the microscope to see what type of cells they have. And they tell us all sorts of information, whether it's an infection or whether it's a tumor, what kind of tumor it is. These machines all run blood work. They're all digital now, so we just put the blood in, and then we have to still interpret it after and figure out what's wrong with the animal, but we get the results really quickly. This is our pharmacy, so this is where we keep all of our medications that we prescribe for the animals at the sanctuary. In veterinary medicine, the veterinarian is a pharmacist and a surgeon and your general practitioner, whereas in human medicine, you would have different types of doctors that went to different types of school to do all of those things. But in veterinary medicine, we do it all. So we'll prescribe medications and our technicians help get those medications to the animals. This is the X-ray room. So we wear these gowns that protect us from the X-rays while we take them. And then the animal is here and the X-ray beam comes down from this part of the machine and takes a picture. After it takes the picture, it pops up here on the screen and then we can see what's going on. And with these digital machines now, we can just zoom in and out to do all sorts of different things. We can make them brighter and darker.
That's awesome.
Yeah.